Welcome to part two of our client meeting series. In part two, we're going to take a look at how we as agents start our client meetings off talking about original Medicare, teaching our clients what part A and B coverage look like, and then segueing naturally into teaching them about Medigap plans. If you haven't watched part one yet, I highly recommend you go back and watch part one before you engage here in part two. It is really important because in part one, we talked about some important things that you should be walking your client through ahead of that initial meeting. Just a reminder here on this next slide that this series that we're working on is focused on in-person meetings. And so we're walking through a little guide that we've created to teach you a basic flow and process for enrollment meetings with clients. The goal here is to give you something that's simple, something that's a basic outline, very repeatable. Now, you may get other advice from your manager that you work with if someone is helping you, and they may tell you to do something a little bit differently than what we're presenting here in this presentation. That's perfectly fine. Our goal here is, again, for in-person meetings to give you a simple, repeatable formula that we know is clear, concise, and can lead you to be successful. And this is really the process that the majority of us use and have used for a very long time in our interactions with clients. Our presentation today, we're going to take a look at steps 1, 2, and 3, where we talk about original Medicare as an instructional piece in that client meeting. We segue into looking at their potential IRMA, income-related monthly adjustment amounts. And then we get into teaching them about what a Medicare supplement plan is and what their options might be. Come back for part 3 of this series where we'll dive into how we present and show the options for both prescription drug plans and Medicare Advantage plans. So one of the first things we do in our meeting, even though this says step 1, is we take some time at the front of the meeting to get to know our clients. This is really important, and I would call it discovery. Ask open-ended questions. Ask your client to tell you about their life or to share their story with you. We want them to talk, and we want to know where they're coming from. They will reveal in that conversation things about their health, things about their income, things about their work history, whether or not they had military service, and them sharing all that information with you will help you understand whether or not you may be needing to talk to them about VA coverage and how that works with Medicare. Or maybe they have an employer plan option in retirement that we need to look more closely at. For us, once we have that initial getting to know you conversation, we start right into a presentation on what original Medicare is. And so we begin the enrollment meeting with a quick overview of the coverage that beneficiaries receive from both Medicare A and Part B. This is essential to create a baseline understanding of Medicare and the need for supplement and advantage plans. For consistency, we recommend using the Part A and B coverage guide. It goes over Medicare cost. It's something that we create for our partners here at TLC annually, and you can find that in TLC's Agent Hub. We're actually going to take a look at that here in a moment together. And as you're listening to this, if you need more training on how to present original Medicare coverage, you can go check out our Medicare Basics course in our agent learning area of TLC Agent Hub. So first, let's jump out here, and I'm going to grab a copy of our sheet that goes over Medicare Part A and Part B cost. We like to go over this at the beginning of our meeting with our clients and just make sure that they understand the foundational pieces of their Medicare coverage. And really, if you're a new agent, you can literally read right off of this flyer, have it in front of them, and explain to them what these coverage amounts are. So we can say quickly, a few minutes, get through this flyer, that the 2026 Medicare Part A coverage is detailed on this flyer that we have here. Part A is hospital insurance that covers costs associated with confinement in a hospital or skilled nursing facility. We have 3 columns here. Column 1 is going to show when you were hospitalized for. Column 2 is going to show what Medicare covers. And column 3 is going to show what your cost would be as a beneficiary and somebody who is covered under Part A. When you are hospitalized for days 1 through 60, most confinement costs are going to be covered by Medicare after you reach the Medicare deductible. For 2026, that deductible amount is $1,736. And we're going to get into some key words here at the bottom, but that deductible, it's a little confusing. For Part A is not an annual deductible. It is a benefit period deductible. We're going to come back to that idea in just a minute. Secondly, if you're in the hospital for 61 to 90 days, Medicare is going to cover all eligible expenses after the patient pays a per day copayment of $434 a day, which could add up, as you see here, to $12,586. That would be if you had to pay that copay every day from 61 through 90. And then if you're in the hospital for 91 or more days, you're going to tap into what are called your lifetime reserve days. Once you use days in this level, day 90 and above, day 91 and above, you're taking from that lifetime reserve and you can't ever use them again. So at that point, all eligible expenses after the patient pays a per day copay would be covered by Medicare. What is that copay? $68 a day for as much as $51,212. If you were in the hospital for 150 days or more, you will pay all costs. And so when we think about the benefit period, let's go ahead and read this statement at the bottom of this box. If you go into a hospital or a skilled nursing facility after one benefit period has ended, in this case, the benefit period is 60 days after being discharged, a new benefit period begins. And there's no limit to the number of benefit periods you can have in a year. So even though it's highly improbable, you could have a client who goes into the hospital for 40 days, maybe in January, and then is discharged in February, and then 60 days or more later is readmitted and now has to pay these deductibles and copays again. Really important piece of information for individuals to know. Now, Part A also covers some hospice, and it's going to cover some skilled nursing confinement. I really don't like the wording here because a lot of people conflate skilled nursing with the nursing home or long-term care. But when we look at Medicare Part A, what we're really talking about is you go to a skilled nursing, typically for rehabilitation, following an inpatient hospital stay of at least 3 days. And then you go to a Medicare-approved skilled nursing facility within 30 days after that hospital discharge, and there you receive skilled nursing care. If that pertains to you, Medicare will cover all eligible expenses for the first 20 days. For days 21 through 100, the patient is responsible for all eligible expenses incurred, which includes the daily copayment. Look to the last column here on the right. So the first 20 days are going to be covered. After the first 20 days, you're going to be at $217 a day, and those copayments could potentially add up to $17,143. We don't go over this information to frighten our client into getting a Medicare Supplement Plan or a Med Advantage plan. We do have to make sure, however, that they understand what Medicare Part A actually covers and what their out-of-pocket risk would be should they choose not to add those additional coverage pieces that we can help them with. On face value, Medicare Part A is covering confinement in a hospital or skilled nursing. It's covering facility fees, right? Room and board in those facilities. It's not really paying the doctors, so to speak, or many of the things that actually take place with you being in the hospital. Many of those are going to fall under Medicare Part B. So let's segue to the Medicare Part B coverage sheet. Medicare Part B is medical insurance. It's going to cover physician services, outpatient care, test, and supplies. And so while we're looking at Medicare Part B, unlike Medicare Part A, we have an annual deductible. This annual deductible amount for Part B for 2026 is $283. When you look at the annual deductible, Medicare will cover 80% of the Medicare approved amount once you, as the beneficiary, have met that annual deductible. It's really not bad insurance. 80% the government's going to pay for Medicare approved amounts, for Medicare approved procedures, equipment, medications. And then after that, you're going to pay 20% as the recipient in most instances. So that's going to include things like medical expenses for the doctor, the surgeon, outpatient physical and speech therapy, clinical lab tests like blood test, urinalysis, home health care, certain home health care, things that can happen with you, certain equipment and supplies. So now we see the remaining coverage items on page 2 for Part B. Outpatient hospital treatment, so hospital services for the diagnosis or treatment of an illness or injury, certain blood coverage there. If we need 3 pints of blood, that's going to be covered, 80% again. And then really importantly, when we look at Part B coverage, excess doctor charges. So that would mean a doctor charges you an amount higher than what Medicare approves. Some states make it very difficult for that to happen, but depending on where you are in the country, you may want to look into your state regulations regarding excess charges in Medicare and see what kind of restrictions might be in place to stop that from being a factor for your clients. If your doctor or provider or hospital charges more than the Medicare approved amount, if all you have is Part B, Medicare is not going to cover any of that. They're going to cover 0% of the Medicare approved amount, as you see here in the middle of our page. You then would be responsible for all cost. Now, look at the little asterisk down here. On all Medicare covered expenses, a doctor or other healthcare provider may agree to accept Medicare assignment. This means the patient will not be required to pay any expense in excess of Medicare's approved charge. Patient pays only 20% of the approved charge not paid by Medicare. Last little note here on Part B, and certainly this is something that we would need a lot more time to get deep in, but we want to be very aware that certain medication treatments are covered under Medicare Part B. Things like a lot of the new immunotherapies that our clients get in a clinical setting, chemotherapy and therapeutic radiation, all of these types of things are covered under Part B. You can simply go to medicare.gov, go to the search box, type in Part B covered medications, and you can see the categories in a list of those items that fall under Part B rather than under Part D. I don't know if we went over it on the first page or not, but there's also equipment that's covered under Medicare Part B, and that's called durable medical equipment. Things like diabetic monitoring supplies, CPAP machines, oxygen, and other items, canes, walkers, etc. All of that durable medical equipment falls under Medicare Part B as we look at this. So with that, we've kind of framed the context and the need for a Medicare supplement plan, right? We've shown the risk for out-of-pocket deductibles and copays on Part A. And with Part B, we're leaving our client potentially vulnerable. Yes, they have a pretty attractive deductible, but they would then in turn be responsible for 20% of their medical cost. And the key thing that we need to always keep in mind when we look at Medicare Part A and B, there is no out-of-pocket maximum limit. So if all I have is A and B and I have a huge medical bill year, I'm paying 20% of my medical bills plus those hospital copays, and there's no cap on my cost. So the risk is significant. And that's where we come in. And in a moment, we're going to show some Medicare supplement plan concepts to help make this more affordable for our clients. Looking down a little bit further on our 2-page handout here, we always want to make sure to reference this with our clients, make sure they understand this, that there are higher costs potentially for their Part B and Part D premiums than the standard monthly amounts that most people pay based on their income. So as we look at Part B and Part D premiums, they are based on your tax filing status and annual modified adjusted gross income. I'm making this recording in 2026, so we're looking back at 2024 tax filing amounts. A quick look at the table here, you'll see several different columns. Column 1 to the left, filing individual taxes. Second column to the right, filing joint taxes, then married and separate filing. And then we have monthly Part B premium and monthly Part D IRMA. As you see, the higher the income, right? You have all these different tiers here. As the income level goes up, the Part B premium is increased. They add an additional amount, an income-related monthly adjustment amount to that Part B premium as we look over here in this column. And the same is true when we take a look at Part D. They're going to add a Part D increase based on your income. We want to make sure our clients are aware of this, and we also can talk them through an appeal if maybe they were making a lot of money at age 64 and then they retire at age 65, they're going to have a considerable drop in income. There's an appeal process that we can help them file with Social Security. So that's the beginning part of what we do in a client meeting. We go over those key A and B costs, and we make sure that they have an understanding of those basic coverages that they get from the government, original Medicare, Part A and Part B. Next, we segue into making sure that we teach key Medicare Supplement Plan concepts, and again, explaining some additional related aspects of Part A and Part B to our clients. So when we take a look at supplement plans, the supplement plan naming conventions, it's through a letter system. And you can see this table here, which I've retrieved from Medicare.gov. I have a link on the slide for you. If you have a PDF copy of this from our website or our agent learning community, you can go ahead and click that link and you'll be able to go to Medicare.gov and see right where I got this from. But this chart shows the required coverage for any carrier that offers a Medigap plan. So Plan A, for example, if you look at the first column, you will see that there are check marks for coverage in the first four columns. So it's going to cover Part A coinsurance, Part B coinsurance, a blood benefit is going to be covered for the first 3 pints. Part A hospice care coinsurance is going to be covered. But then we have red X's. It's not going to cover skilled nursing facility coinsurance. It's not going to cover the Part A deductible. It's not going to cover the Part B deductible. It is not going to cover Part B excess charges. And so that's Plan A. And a carrier that's offering Plan A would build it in that same design and scope. So from carrier to carrier, Medicare supplement plans are going to look very similar. We will talk about some of the subtle nuance that carriers can inject into their plans in a little bit. Most clients who want total maximum coverage from a supplement plan, if you look over here in the middle of this, we're going to be looking at Plan G. And the reason is, as we go down the check marks in the boxes, you're going to see a lot of green X's. So Part G is going to cover pretty much all of the patient's responsibility under Part A and Part B, except for the Part B deductible. So we're going to have many clients that choose that as an option. They're going to pay their Part B deductible first. This year, that's $283. And then Plan G is going to pick up the remainder of their Part A and B expenses. Again, key words for Medicare approved amounts. Importantly, Plan G is the only supplement plan still in our market that covers excess charge. So you'll see that down there. Plan G has the only green check mark, other than Plan F, which is no longer available for most of our retirees. So that's going to cover excess charges. We also have a lot of clients that look at Plan N. It's very similar, only it does not cover excess charges, and Plan N has some office visit copays that you need to know about before you present that plan option to your client. At the end of the day, this is a really great resource to have because you can neatly see how all the different plans, A through N, are structured and what kind of coverage the carriers have to offer our clients. So as we think about Medigaps, there is a Medigap open enrollment period. Under federal law, your client's going to get a 6-month Medigap open enrollment period, and it's going to start the first month that they have Medicare Part B and they're 65 or older. All this information is pulled from Medicare.gov, so during this time, you can enroll in any Medigap policy. You will generally get better prices and more choices among the different policies. You can buy any Medigap policy sold in your state, and insurance companies, importantly, cannot use medical underwriting to decide whether to accept your application, and they can't deny you coverage due to pre-existing health problems. Think about how important that is to know, right? That when I'm in this initial Medicare open enrollment period, a company can't deny me and they can't rate me higher no matter how bad my health might be. After that period of 6 months, you may not be able to buy a Medigap policy, or it might cost more. So your Medigap open enrollment period is a one-time enrollment period. It's once in your life, and it doesn't repeat every year like the Medicare open enrollment period. So we really want to know this, and we don't want to strong arm our clients or scare them into going on a Medigap plan because of this. But it's really important that when someone's new to Medicare, they know in, you know, strong detail that after 6 months, it may become much more difficult for them to get a Medicare supplement plan, especially if they're either unhealthy now or if they are healthy now and their wellness decreases over the next 6 to 7 to 8 months. And so here's a little graphic again that I took from Medicare.gov that just shows your Medigap open enrollment period. Once again, one-time enrollment period does not repeat every year. It starts once you have Part B and you're 65 or older. You get to 6 months to enroll. No medical underwriting, no denials. A couple of key aspects of Medicare supplement plan options here for you. One is excess charges, which we touched on a little bit ago. If you have original Medicare and the amount a doctor or other healthcare provider is legally permitted to charge is higher than the Medicare approved amount, that difference is called the excess charge. As we looked at on every Medicare supplement plan other than F and G, you would bear the responsibility of paying the full excess charge as the Medicare beneficiary. Extras and discounts. I said we were going to get to this. Some of the ways that carriers sweeten the deal for a Plan G, for example, they offer discounts for women, non-smokers, married people. They might give you a discount for paying yearly, paying your premiums using an electronic funds transfer, or discounts for multiple policies for certain carriers that may offer more than just health insurance. It's important to know this, and it's unfortunately kind of hard to figure this out. We certainly can't track every supplement plan in every part of the country and have a really good resource to show you all these discounts. You really have to dive into your specific market and zip codes that you really want to focus on. Some plans also offer fitness memberships and other discount options in certain service areas. There are a lot of different Medicare supplement plan options now that have kind of created some nuance over what used to be pretty straightforward for us and our clients. Medicare Select plans, I've seen agents inadvertently place somebody in a Medicare Select plan G when they intended to put them in a regular plan G. A Medicare Select plan is a type of Medigap policy that may require you to use hospitals and in some cases doctors within a network. And so now we're taking a Medicare supplement plan, which part of the large appeal is if I have original Medicare in Plan G, I generally don't have a network. I can generally get service and support and care from any doctor or hospital in the country. If I'm on a Medicare Select plan, I now have some network provisions that I got to kind of be in line with to get my care. Really important to know that and to study those plans carefully if you are going to put a client in those. Something else you need to be aware of are these high deductible plans. So if you buy plans F or G, or if you bought Plan J prior to January 1st of 2006 with a high deductible option, you would pay the first $2,870 in 2025 of deductibles, co-payments, and co-insurance for covered services not paid by Medicare before the Medigap policy pays anything. You also pay a separate deductible for things like foreign travel in many cases and prescription drugs that might be covered by your Medigap policy if you have Plan J and it still covers prescription drugs. So I'm doing this presentation in 2026. I know I still have the 2025 number here, but the whole gist of it is a high deductible Plan G, for example, will have you pay as the member a higher amount like this as the deductible, and then it becomes more of a traditional Plan G in terms of coverage. And typically because it has a high deductible, it also has a lower premium. So you may have clients that have high income, high wealth that are okay with a small deductible in their case, $3,000. They're generally healthy. They don't access the doctor or the hospital hardly ever. High deductible plan might be something you discuss with them. And then we get into this, which is called innovative Medicare Select plans, a newer hybrid type of Medigap policy that might include an annual deductible, similar to high deductible plans that must be paid before the plan pays for Medicare covered Part A and B costs. Now, unlike high deductible plans, these plans phase out the high deductible and move to an annual Part B deductible amount after an initial term, typically 3 years. So, pretty cool concept here, right? You're turning 65, you're generally healthy, you're going to live with a high deductible risk for maybe 3 years. And then after that, you're going to have a regular Plan G. So, again, when you go with an innovative Medicare Select Plan G, your premium is generally lower than a normal Plan G. So we're going to get into some of these here with a demonstration, but there's a lot of different methods that you can use for comparing rates with Medicare supplement plans. Today am going to show you how to do that in Smart Enroll and also on MyQuote, which are two resources that we provide for you here at TLC. You can do the same on Medicare.gov if you want to check Medicare supplement rates there. Many of the carrier enrollment kits have the rate tables right in them, and you can download rate sheets from many of the carriers' websites and keep a binder. Sometimes it's honestly the easiest way. Have all the carriers in your area that you know are very competitive in a binder, their rate sheets. You can look up the person's age and zip code very, very quickly, and we'll get into some of these in a moment. We also have some Medigap basic resources for you here that go a little more in depth about some of the things we just talked about. There's a quick article on Medicare supplements, a link to a Medicare cost or a Medigap cost sheet, and then a Medigap plan comparison chart. So with that, we're going to segue into TLC Agent Hub, and I want to show you this tool that we have available for you here called MyQuote. So I've explained the basics to my client about what a Medicare supplement plan is. And now I'm going to go to MyQuote and I'm going to click on Run Quote. Let me just plug in a zip code here. It's going to populate the county. I'm going to go 65-year-old male. Tobacco usage, we're going to leave it at non-tobacco, Plan G. And I'm going to click Get Quote. So now we have a quote here. It's going to show you all the available carriers in the area. In the left menu over here, I'm going to go ahead and click on the Market Analytics. In the left menu here, I'm going to go ahead and click on Market Analytics, and that's going to add some data that I like to look at. It's going to add age increase percentages. It's going to add an increase history here in the middle, and it's going to add market data to the right. What I like about MyQuote is it shows you the cheapest plan all the way up to the most expensive plan. And it shows some really key indicators. In the top corner of each carrier's site, or quote rather, it's going to show you years in the market. So this plan from Cigna has 2 years in the market. Again, we're looking at Plan G here in the middle. And then it's going to show an increase history. Well, there's no increase history data here because this plan's only been in the market for 2 years. Over here on the right, I'm going to see lives, which is how many people have that plan. I'm going to see premium, loss ratio, and then market share percentage, okay? And I'm going to have the ability to toggle through some different years here all the way back to 2024. That's all the data we have as of right now. So why would I want to look closely at that? We're looking at putting our clients into a policy. We really don't have a crystal ball. We don't know what's going to happen to their med supp rates year over year. We do know, though, when we have historical data, generally how well the carrier has treated our clients. We also do know that sometimes when a policy looks really inexpensive, it may be an introductory rate because that plan is new to market. Like in this case, we're 2 years in. So we take a look at Physicians Mutual Plan number 2. Same thing, 3 years in market, pretty good loss ratio, 83%. They got 26,000 lives. And it looks like in 2025, Plan G for them had a 24.1% increase. I also want to point out in the top left, I said earlier it's kind of hard to find these discounts. Well, this MyQuote tool will show you what the household discount rate is here in the top left corner. It's also going to show you the discount type. So for Physicians Mutual, we don't have to even be a married couple. It's a roommate discount, 2 people in the same house. We get a 9% premium discount. Let's go to the next one, Baker's Fidelity, 3 years in the market. In 2026, they took a 12% cost increase. They have 3938 lives, so 3,938 lives insured. You can really dive in here. This is a great tool for market research. We cannot do enrollments from here, but it will help us get a sense of rates and what might be cost effective for our clients. As we go down and things get a little bit more expensive, we're going to see, for example, let me go grab AARP just for a comparative here to what we just looked at. So 178.56 per month. We have a 7% household discount for multi-insured. And what we look at is we have all this increase history data with an average over the last decade of a 2.7% increase. We also can see that there are 3.8 million people that are insured nationally. In my state, 192,000. With all of those lives, they still only have an 83% loss ratio. And, that's a little bit of a stability factor that we can see with 28 years in the market. So certainly my quote, great for market research. You can also select a few policies to compare and download a quote if you want to send that to a client or share that with a client. And this is freely available for you right inside of TLC Agent Hub. So up next, let's jump over to Smart Enroll. I'm going to pick up with the same client that I created on our first session before we jumped off into session 2. And I'm going to scroll down now on the client profile screen, and we're going to go ahead and continue over to plans. So this is the plan quoting screen, quoting and comparing screen inside of TLC Smart Enroll. For our purposes today, we're going to go ahead and take a look at Medicare Supplement Plans by clicking this box. And it is going to require me to enter some additional information. So I have my dad's birthday in here. Let's choose an effective date of March. We'll go height, 5'10". And then weight. Payment method will be monthly. Were you Medicare eligible due to disability or ESRD? We'll say no. We're going to pick yes on electronic funds transfer. Some carriers will give a discount for that. Hospital A and B effective date. And we'll say yes for a household discount. Down here, we pick an enrollment option. For our purposes today, I'm going to choose new to Medicare, basically. You turn 65. And let's continue to plans. So this will also allow me to see, in order of premium, low to high, the plans available in our area. I'm going to go ahead and hit the filter button here. I can select different carriers if I so choose. I'm going to go ahead for today and click Plan G. And just for demonstration purposes, I'm going to click Plan G High Deductible. We'll click Apply. And as these plans are now sorted, low to high, you'll see the lowest cost plan is only $58.45 a month, but that is a high deductible Plan G through Humana. Let's look at the plan details here. And so $58.45 a month with a $2,950 deductible here in 2026. Outline of coverage is available right here if I want to take a look at that. But I'm not sure that's going to be a good fit for my dad. I don't think he's going to want to pay a $2,900 deductible every single year. So as we scroll down, you're going to see high deductible under plan type. Here's a Plan F high deductible. The reason that Plan F is showing for my dad is he was eligible for Plan F. He was on Medicare prior to Plan F being phased out of being accessible for people that are new to Medicare. So I'm still looking at high deductibles. Here's Plan K, Plan G high deductible, Plan F. Let me go back to my filters here because I think they may have gotten knocked off. Yep. I'm going to just go to regular Plan G now. And so here we have Plan G. We have $151.18 coming at the lowest rate with my carriers here, United Healthcare. Let's add this to compare for a minute. So then we have Humana, $168. We have United Healthcare, $185. And we have another United Healthcare, $202. So why are there three United Healthcares? Let's compare. This is where there's a little bit of subtlety that we kind of have to dive into and make sure that we know what's really happening with our carriers, train with our carrier partners at the events that they put on. From right to left, we're going to start on the right where we have the lowest premium, 151. Why is that a lower premium? The key word is select. So if my dad chooses that plan, he's going to be subject to some network limitations, and maybe he doesn't want that. So these other two plans do not say select, they do not say high deductible. So what's the difference? Well, this one that's 185.18 is offered by United Healthcare Insurance Company of America. And then this one is United Healthcare Insurance Company. So there are some subtle differences. One being premium, those plans have a different discount structure. One includes a fitness membership and one does not. And how do I know that? Market research, studying the plans, working with the carriers, going to their presentations, asking good questions about, hey guys, why do I have two plans here that look really, really comparable? So this is the way that we go about comparing rates. Again, you can do this on Medicare.gov. We can do it here in Smart Enroll, and we can use my quote to zero down in on those rates. Everybody likes to ask, Smart Enroll is really great for Medicare Advantage applications and Part D applications. But if I want to apply for one of these for my dad, if I click add to cart, let's see what actually happens here. It's going to add it to the cart, and I'm going to click continue to apply. And I'm going to check this box. I'm going to click continue. And Smart Enroll is going to redirect me to the carrier site. And I'm going to have to log in and complete that application on Jarvis. That is the way that Smart Enroll predominantly is going to work when it comes to Medicare Supplement Plans. They're just very complicated contracts that we have to fill out, or I should say applications rather, that we have to fill out. And so we need to segue and do those in the carrier sites. When you come back for session 3, you will see that we can easily do the applications for many of the carriers for both Medicare Advantage plans and Part D plans right here inside of Smart Enroll. With that, I'm going to go ahead and wrap up. And Part 3, again, we'll go over how we show and compare Medicare Advantage and Part D plans for our clients. We will also talk in Part 3. So we've gone over this Medicare supplement piece, right? And we've shown our clients an option. I'll show you this again in Part 3, but I like to keep track of what I showed them. So maybe my dad or the client that I'm meeting with, did they say, okay, well, that I like that rate. I like the market research that you showed me on that plan. I don't want to select. I don't want a high deductible. So I want a regular plan G with a really reliable carrier. I'm going to write down, even if it's on a piece of paper in that meeting, I'm going to have 2 columns, right? Column 1 is going to be pathway 1, which would be supporting their original Medicare with a Medicare supplement plan. And then what we're going to get to in the next session, which is a standalone prescription drug plan, and then vision and dental. So in column 1, I'm going to initially start off here by writing down, we looked at AARP Supplement Plan G. The premium for you would be $202.24 a month. And that way, as we kind of build through this presentation, we can keep track and help them see the difference between the 2 coverage models. That's it for now. Please come back and check out session 3. And thanks for investing in your learning and development.